for years and years and years, people have been talking about how we need to adopt health IT, how it's necessary, and so forth, and now it's happening.
Benefits of health IT, but in the past, there were too many barriers. It was too challenging, many record systems weren't interoperable, a lot of people thought if I adopt a system and spend all this capital, I'll find out that I can't communicate with anybody else across town, much less across the country. So President Obama decided really as one of the very first acts that was taken in his presidency that the adoption of electronic medical records was an essential building block to a transformation of the health system. We now have more than 100,000 primary care providers who have registered to take advantage of that assistance with the regional centers, and that's a third of the primary care providers in this country are now enrolled and enlisted and ready to make that transformation. Over 70% of rural primary care providers are registered, and in some areas it's as high as 90%. The Ohio Information Partnership is one of those shining examples.
In Cleveland, we're really blessed with a rich history of electronic health records and also of data sharing and work to improve the health of the public. And so we decided that we were going to report our experience in January or February of this year, and we're honored to have it published in September.
The vision of university hospitals is to improve patient care and outcomes, and the evidence that we've been able to bear with the implementation of the electronic medical record have been that outcomes are improving. We have an 87% physician adoption of electronic order entry. The national benchmark is 50%.
We have a patient at the Cleveland Clinic who's a truck driver, and he loves his work. And as a result of that, he's rarely in Ohio, but his physician is at the Cleveland Clinic. So how can we take care of him, produce the right outcome for him, but allow him to pursue what he really loves? And the answer, I think, comes from this program that we call Meaningful Use, but I think it really makes a meaningful difference.
I was unemployed for over 2 years, and I said, I'm a smart person. I am an employable person, but there's no jobs in what I am qualified to do. I started to do a search of things that I already had in my background with health. I included the term grant in those search, and Health Information Technology Grant Program came up. I called the folks over at Tri-C, what is this all about? And they said, it sounds like it's a good fit, send us your resume, apply, and the rest is history.
Always have been very connected to within our healthcare communities. And so we're very, very proud of what we've accomplished in a very short period of time. We did that by leaning into each other, being very innovative, collaborative. We've used a lot of technology in our collaborations, but we've used a lot of face-to-face meeting. Our community colleges, not only here in the Midwest, but across the country, are very passionate about retraining and really filling the void that has been created for the emerging workforce.
What the Secretary's announcement today addresses is an issue that the Health IT Policy Committee, and hearing from a lot of feedback from folks out there, were that some people were hesitant to move forward on a testing to meaningful use in 2011, this year, and they can still do it through February, because according to the current rules as they were written, that group and that group only, those who had tested in 2011, would have to step up to stage 2 of meaningful use within a very short time frame in 2013. And what the Secretary is announcing today is there is no reason to wait. If you are ready to go for meaningful use in 2011, by all means, like those over 900 providers from Cleveland Clinic who took the plunge and said, we're ready, we're going to go for meaningful use in 2011, we're saying to you, there is no reason to wait.